Opioid prescribing is a partnership between you and your doctor, and that relationship needs to be preserved. It can be a challenge when receiving opioids to have conversations about them. Sometimes patients come into the doctor's office with an understanding of exactly what they think they need or want, but that prescriber may have very different views on the topic. Keep in mind that keeping the relationship civil, kind, and professional is going to be key to a good long-term relationship when opioids are used. These are the things that you can probably expect when you get an opioid. First, your doctor will probably screen you for risk factors. Things like heart problems, lung problems, kidney or liver problems can put you at higher risk for opioid-related overdoses. In addition, your doctor will probably screen the type of medications that you take. Certain drug classes like benzodiazepines or sedatives can put you at higher risk for opioid overdoses. Your doctor may consider using non-opioid therapies as first-line therapy. So this might include non-opioid pharmacologic treatments, acetaminophen, known as Tylenol, or anything from the NSAID class like ibuprofen might be a better alternative. In fact, the data shows for many conditions, they're actually more efficacious than opioids themselves. If your doctor chooses to use an opioid, there's a good chance that they might go ahead and combine it with other therapies like physical therapy, occupational therapy, and then use non-opioid pharmacologic therapy in addition. If your doctor feels that chronic opioid therapy is right for you, you might also expect to see other things involved, such as signing an opioid therapy agreement, which outlines the best practices for you as a patient to follow to make sure you stay safe on them, and have you sign it to make sure you know that this is an agreement between you and your doctor and you will follow it closely. Your doctor may also have periodic screening things that make sure that you don't have opioid-related complications, such as addiction. Things like urine drug screens and pill counts might be integrated into part of your therapy plan. Remember, all of this, although it can be a little bit challenging to navigate, is for your safety and in your best interest. Best practices when you encounter your provider or you need refills is to do so with an understanding that your prescriber may not necessarily give you exactly what you want. And that's because they're screening, they're monitoring, and they're thinking about the big picture. As long as you're willing to work with your prescriber is willing to work with you. So keep that relationship holistic and make sure you stay in close contact. What if we are the generation that ends this opioid epidemic for good? Opioid-related overdose deaths are now the #1 cause of death in adults under age 45. Their influence has been so great, they're even reducing the American life expectancy. These trends have us fearing the worst, and as a result, we begin to view opioids as the enemy. The drugs that we've long trusted to help kill pain are now killing us, and with this, we fear what they'll take from us when we take them. But what if opioids aren't the enemy? What if our misunderstandings of them was? What if we truly took the time to understand pain and addiction from the perspective of those dealing with it? Would our stories have happier endings? You see, the opioid epidemic is always personal. I lost my own nephew, just 24 years old, after sustaining a head injury in a skiing accident, unable to live with the pain anymore and unable to navigate the medical system, to suicide. You see, the opioid epidemic is a story about all of us. It's about the people we love, the people we've lost, and the people we fear losing. Medical providers can't prescribe us out of the opioid crisis. Government agencies can't regulate us out of it. Drug treatment programs can't counsel us out of it. It is time that we start to fight the myths about opioids instead of the drugs themselves. What would the world look like if we were equipped with the information on how to use opioids wisely, store them safely, avoid their risks, and reverse their problems? It's time we turn our attention away from the battle against opioids and instead put our focus on the people who may truly benefit from their use, or those who are facing their consequences. What if we all work together? Hope is in sight, and this crisis is ours to end. This can be the generation to do it. That ending must include you.